Hello, everyone. I'm Lana Zach. Thank you so much for joining me. President Biden is criticizing Texas and Mississippi governors for lifting coronavirus restrictions, including their mask mandates.
I think it's a big mistake. Look, I hope everybody's realized by now, these masks make a difference. We are on the cusp of being able to fundamentally change the nature of this disease because of the way in which we're able to get vaccines in people's arms. We've been able to move that all the way up to the end of May to have enough for every American, to get every adult American to get a shot. And the last thing we need is the Neanderthal thinking that in the meantime, everything's fine, take off your mask, forget it. It still matters.
More than a dozen states no longer require face masks, but top health experts warn now is not the time to ease restrictions. The head of the CDC says the next 3 months are pivotal in the nation's fight against the virus. Officials remain concerned as well about variants as cases tick back up. The total number of infections in the U.S. is now at more than 28.7 million. More than 518,000 lives have been lost. Janet Shamlian begins our coverage in Houston.
Blowback from the Texas governor reopening the state was fast and furious. From the president,
the last thing we need is the Neanderthal thinking,
to the CDC director.
And the exact measures we have taken to stop the pandemic are now too often being flagrantly ignored.
And on the ground in Houston, Harris County Judge Lena Hidalgo.
I can't sit by quietly while somebody tells my constituents that everything's okay, that life can go back to normal, when I know those words will lead to death.
You believe the governor's loosening of restrictions will lead to more deaths?
Oh, I'm certain of it.
Texas will be one of 16 states without a mask mandate. Mississippi dropped its requirement today. But businesses like Houston's St. Arnold Brewing Company won't be following the governor's guidance.
We are going to follow the CDC guidelines. We disagree with that ruling.
How do you think your clientele will react to your keeping your masks thing in place?
So far, the reaction has been overwhelmingly positive. It's really adapting on the fly. And I think bars and restaurants and businesses have been doing that for almost a year now.
Target, Kroger, and Macy's among retailers saying they, too, will still enforce masks in stores. CBS News has learned the CDC will release guidance tomorrow on what fully vaccinated Americans can do, including small gatherings without masks. Governor Abbott pointed to increased vaccinations, a one-day record this week. But with a population of 29 million, the state ranks among the last in doses administered per person. Texas now reporting about 7,000 new cases each day. That number was 5,000 a day when the governor reordered a lockdown last summer.
95% of people in this state have not yet received their 2 vaccines. We've got a long, long way to go. We know that the virus hasn't disappeared, and we got to continue buckling down.
Even as this brewery says it will continue to observe distancing and mask wearing, it's important to note there's a lot of people here in Texas who are very happy with the governor's decision. They say they are ready to get back to normal, despite medical guidance. Lana?
Janet, thank you. Millions of Americans who received coronavirus stimulus checks under the Trump administration might not get one this time around. Weijia Zhang is at the White House with more on a big change to the COVID relief bill.
Well, moderate Democrats have long complained that these $1,400 checks are going to people who make too much money, and President Biden has to make them happy because he needs every single Democratic senator on board to seal the deal. So under this new agreement, individuals making $80,000 or less will receive a check, and so will couples as long as they don't make more than $160,000. Now, these income caps are down from what House lawmakers approved. Moderates also wanted to reduce the amount for emergency unemployment benefits, but the president is standing firm on that figure, which is $400 a week. Now, the earliest that senators could vote on this bill would be this weekend before sending it to the House. Democrats are scrambling to get a final bill to the president to sign by March 14th when the current unemployment benefits run out. Lana?
Thanks. We did right around the corner, that expiration date. All right, for more, let's bring in infectious disease expert, Dr. Amesh Adalja. He is a senior scholar at Johns Hopkins University, Bloomberg School of Public Health. Dr. Adalja, thanks for being with us and for all that you do. So let's get right into it. Texas, other states facing backlash for lifting these COVID restrictions. We just heard the CDC director saying that measures are being flagrantly ignored. What's really at risk if people start letting their guards down now?
I think what we have to worry about is that people forget that we're in a pandemic and that our vaccine rollout isn't as great as we want. And we get more transmission and we get more cases and we put our hospitals into crisis again. That being said, I think in Texas, you have to separate the capacity restrictions issue from the mask mandate issue. I think that there is an argument to be made about going from 75 to 100% in restaurants. But I think the only way that that happens in a safe manner is if people are wearing masks, because we know there's much community transmission and not enough people vaccinated in Texas to be able to forego masks. And we know that masks are going to work. So I think that they should separate those two decisions. And if they're going to increase capacity, you want to be sure that people that are in restaurants, that are in businesses, are wearing masks as much as possible in order to keep that spread down until we can get enough people vaccinated. They look good on hospital capacity, but we don't know how sustainable that will be with the new variants. But hopefully it won't turn out as bad as people are worried about.
Dr. Adalja, your audio got a little garbled there. Are you talking specifically, when you're talking about restaurants and increasing the capacity and the mask mandates, are you saying that you want to ensure that the people who are working at the restaurants are wearing their masks? Because as we know, people necessarily need to take off masks in order to eat in restaurants.
Exactly, that I hope that restaurants will continue to enforce mask wearing etiquette amongst their employees and among the patrons when they're not eating, when they're going to the restroom, when they are walking about, that they're wearing a mask, and only when they're eating do they take their masks off. I think that's an important part of that. I think that there are some best practices restaurants can do to be safer, but I think that if you were going to move to 100% capacity, I would have kept that mask mandate in place until we had more people vaccinated. I think that's the danger that we're seeing. And this is similar in Massachusetts. They went to 100% capacity in restaurants, but yet they have a mask mandate around for the rest of the activities that people do. I think that's the part to think about, is masks have been shown to be really instrumental in decreasing cases, especially as people get back to some of their activities.
All right. Well, just over 8% of Americans have been vaccinated. Remind us again where we need to be to feel comfortable about resuming a lot of these activities of our regular lives.
It's going to take some time to get enough people vaccinated to cross that herd immunity threshold. But the bigger thing to me is getting all of our vulnerable populations vaccinated, those people in nursing homes, the community dwelling, high-risk individuals, because once you do that, you will start to have hospitals breathing freely, that they won't be worried about capacity restrictions, and people will have seen the virus as a lot more tame than it is when you remove the ability of it to cause severe disease, hospitalization, and death. So I think as we move through these priority groups, we will start getting closer to normal. The herd immunity threshold is going to probably come sometime in summer that we pass, but I think we will start getting some semblance of normalcy before herd immunity as vulnerable populations are protected and hospitals don't have to worry about their capacity on a day-to-day basis.
So, Dr. Adalja, I want to talk to you about variants, because a whole bunch of us in our virtual newsroom have been pondering this question. The CDC reports that coronavirus variants have been linked to more than 2,500 cases here in the United States, but officials believe that that number is much higher. So here's our question. If you're infected with a variant, how can you tell? Does it just show up as a positive on a regular COVID test, or is there something more going on?
Exactly. It will just be a positive on a regular coronavirus test. And some percentage of those samples get sequenced at a State Department of Health laboratory at the CDC. So you won't be able to tell that you had a variant. And often this isn't even done real time. You only hear about it retrospectively that was a variant case. But the symptoms are basically identical. You would not be able to tell it with a normal test. And that's why we have to get better at sequencing, so we have more situational awareness of where these variants are in the country.
Well, we've been spending a lot of time looking back at like a year ago, given that we're coming up on that anniversary. And at one point, we were concerned about a double punch of COVID and the flu, but flu numbers are way down. 195 children died from the flu in the 2019-2020 flu season, according to the CDC. But in the pandemic flu season of 2020-2021, only one child died. Is this drop because of all the things that we're doing to prevent COVID? And is there a way that we can keep these flu numbers down even as our world is opening back up?
I definitely think it's because the social distancing, the hand washing, the masking that we're doing for COVID-19 is basically stopping flu in its tracks. And flu cannot transmit as well. And plus, we've got people that are vaccinated against flu. So I do think we're seeing this kind of added effect of COVID-19 measures against flu. It will be interesting to see what happens once those restrictions lift. If you start to see flu come back, flu is a tenacious virus. I suspect we're not done with it. We have to prepare for flu. Flu is probably the biggest pandemic threat that we face. But so far, this season has been uncharacteristically mild, and it has to do with the fact that all of our COVID measures have a double effect on other respiratory viruses, not just flu, but RSV and adenoviruses. Many of our common cold-causing viruses are really stymied by what we're doing right now.
All right, Dr. Amesh Adalja, thank you.
Thank you.